Hi, my name is Dr. Gronske and I will be assisting you today.
Hi, Dr. Gronske. My name's Abby Mastrone.
Have you ever talked to a doctor through telecommunication?
No, I have not. This is actually a first for me.
Well, I hope you have a positive outlook on this different medical approach.
Do you use this often with your patients, or is this due to a time constraint today?
Telemedicine is a way of communication that doctors are trying to use more frequently as a benefit to both the doctor and the patient to communicate more effectively.
That sounds like an awesome idea. I'm sure it will be just as helpful as a normal doctor's visit.
So just a little background information about myself. I'm a licensed sleep specialist. I have studied sleep disorders for over 15 years and currently just started my own practice in a new location that's set to open in the summer of 2016.
That's great to hear. I came to you because I've heard that you study many different kinds of sleep disorders, not just the most common ones.
Yes, that is true. How are you today?
I'm doing all right. Pretty tired, though, lately.
Tired? How has college been for you this year?
Well, I'm keeping myself extremely busy with school and work.
College can be a tough time, especially when it comes to getting enough rest. What year are you now?
Currently, I am a junior.
Wow, so close to graduation. Do you feel ready?
Not exactly. It's kind of bittersweet knowing college is ending so soon.
College holds some of the fondest memories for me. Make it count. Now, you said you've been having trouble sleeping. How can I help you today?
For the past few months now, I've been having trouble falling and staying asleep. Also, my mind tends to keep me up later than I wish it would. I'm not sure what is triggering this, and I hope to find out this underlying reason.
Okay, that's a good start. Could you go more into depth about your symptoms so that we can try to figure out the exact cause of your problem?
My main problem each night is difficulty falling asleep. Furthermore, I also usually tend to wake up during the night at least once or twice. I never understand why this happens, so this is the main reason why I came to see you today. Also, I tend to feel very tired throughout the day, and this makes it hard to focus on easy tasks.
When you can't fall asleep, do you feel anxious knowing that you're about to get little sleep?
Yes, every night before I fall asleep, I tend to have a fear that I will not be able to fall asleep, because it's usually a routine that I cannot fall asleep. As a result, I'm constantly in a cycle of trying to get myself to fall asleep and worrying I will not get enough.
How long have you been experiencing these symptoms?
I've been feeling these symptoms for about almost this entire semester, so around 4 months.
Do you find yourself having to move certain types of your body?
At times I feel the need to move my legs around to get more comfortable. I kind of move them side to side on my bed and wiggle my toes so I can get more comfy in a more comfortable position. However, it starts to become a disturbance, eventually due to my inability to fall asleep.
When you don't get adequate amounts of sleep, how does this affect the way you act the next day? Describe your typical mood.
As mentioned before, I tend to feel really irritable and feel unrested. The next morning and day, I feel as though I cannot get homework or tasks done easily. I also feel as though I have an increase for errors and mistakes. At times, I think that due to the lack of sleep, I tend to have less awareness of my surroundings, which makes decision making more challenging.
How is this affecting your social life and your interactions with others?
I found myself to be very irritable towards others because I'm so cranky from not getting enough sleep. I can feel my friends pulling away from me since I can't seem to enjoy myself when I go out. Since I'm lethargic all day, it makes it difficult to enjoy my time going out with other people until late at night. I have anxiety that by the time I get home from wherever we go out, that I won't be able to fall asleep.
I see the repetition of your description of anxiety. Is this something you have experienced before?
Not really. I've always had a little bit of anxiety, but I believe that it's due to school and stress from homework and classes.
Okay, that is normal for a college student, but do you feel like the anxiety has increased since you've had trouble sleeping?
Definitely.
Do you find that you can't concentrate in classes?
Due to sometimes waking up on and off during the night, I feel as though I'm not truly refreshed during the day. As a result, I tend to have a hard time concentrating during class because I feel so exhausted from the lack of sleep.
So you're describing a situation in which you have trouble falling asleep, and once you do, you have trouble staying asleep. You also mentioned that because of lack of sleep, your daily quality of life has decreased. From the information that we have just discussed, I feel as if you might be suffering from insomnia. Since you mentioned that this issue has been happening for at least 4 months, I would consider the insomnia to be chronic.
Chronic? That doesn't sound too good.
That word may seem scary, but in reality, it isn't. I think that it is important that you understand you are not alone. Between 10 and 15% of adults suffer from chronic insomnia.
I guess not. Knowing I'm not alone is helpful.
Another thing that I should mention is that more than 70% of college students have sleep problems. So you are really a part of a large population of people with insomnia.
Wow, there are a lot of more people affected by this than I was aware of.
Even the fact that you are a female, you are more likely to have a shorter and poorer sleep quality.
Well, that isn't great news.
Just another thing to add to a list of things that women have to suffer through.
So what are some possible steps to take towards getting better quality sleep?
So the next thing we have to discuss together is how we're going to help you achieve this.
All I could ever ask for.
Do you find that you take naps during the day to help combat the sleepiness that you feel?
I'm an avid napper. I try as often as I can because I don't sleep much at night.
So, the first habit that I would like for you to change is to stop taking naps, especially if you are taking them after 3 p.m.
Wow, that's really going to be hard to adjust to.
I wouldn't think of it that way. You have to think positively and think that not sleeping during the day is going to help you sleep longer and better through the night.
When you put it that way, it sounds so much more relieving.
So the next thing that I would like you to do is to reduce your caffeine intake. I know this may be difficult as a college student, and you need to get work done, and it will be helpful with that, but it is also keeping your body up when it doesn't need to be.
Does that mean I can't drink at all?
Of course not. I'm just suggesting that you stop drinking the caffeine at least 5 hours before you go to bed. So, if you go into bed around 11 p.m., I wouldn't drink anything with caffeine after 6 p.m.
Okay, that's manageable.
Great. The next thing I want to focus on is the time that you actually go to sleep. What time do you usually get ready for bed?
Well, it really depends on how much schoolwork I have to get done.
If you had to guess an average time,
I'd probably start to get ready for bed around 11:30, and I think that I don't fall asleep until at least 1 a.m., maybe even later than that.
Okay, so here's what I'm going to tell you to do. Try to go to sleep at a later time. I know that seems backwards, but in addition to not taking naps and going to bed later, your body is going to be tired and ready for bed around 10:30 p.m., and you will be falling asleep much easier.
I'll try that. For how long should I do that?
Try it for a few weeks, and every week you can go to bed around 30 minutes earlier and see if it's helping.
Seems easy enough.
I have one more question for you. Do you find yourself watching the clock and calculating the amount of time you have before you have to wake up?
Every single night.
Alright, I want you to remove the clock from your sight, and I also want you to put away your phone not near your bed. I'm sure you use it for an alarm clock, but it will help so you don't have your eyes adjust to the light and trick your brain into thinking it is daytime, and it will also help you not watch the clock. While the phone may be across the room, it is also more incentive to get up and shut it off in the morning.
I think I can manage that. It'll be hard in the beginning, though.
Probably, but it will get easier as you practice this every night. Another thing that I want to see change is to make sure that your wake up time on the weekdays and on the weekends are within an hour and a half within each other.
What do you mean by that?
For example, if you wake up at 8:30 a.m. every day during the week, I want you to wake up by 10 a.m. on the weekends. If you wake up at 9:30 on Fridays, try to wake up by 11 a.m. on Saturdays. Does this make sense?
Yeah, it does.
Okay, great. One thing that I'm sure you are worrying about is the pharmacological approach to this issue.
Yes, I was actually wondering if you were going to give me a sleeping pill to take.
Lots of doctors will prescribe pills to a patient without learning about the issues the patient is going through and not give them other interventions to try first. Ambien is the most popular pill to take, but I'm not going to prescribe it to you unless the other interventions aren't working as well as we'd both like.
That makes me feel a lot better about this issue.
I'm glad. Now every night I want you to keep a journal of the time that you are going to bed and when you are waking up. Then I want you to contact me either through email, call, or through video chatting and catch me up with the way you are feeling. After 3 weeks of this, I want to re-examine your sleeping habits and see if you are feeling more refreshed during the day.
Okay, got it.
Do you have any additional questions for me?
I think you've covered anything that I could think of. Thank you again for everything.
My pleasure. It's what I'm here for. Please do not hesitate to reach out to me if anything else arises.
All right, it was nice speaking to you.
Have a wonderful day and get some sleep. Hope to hear from you soon.
Thanks again. Talk to you soon.